If you've been working in healthcare for years and you keep getting passed over for coordinator and manager roles because you don't have a bachelor's degree, I'm going to show you how people in your exact situation are finishing theirs online in about 75 weeks so they can finally be considered for those roles. And if that sounds like the direction you want to go, you can click the button by this video and book a quick career path call to see if this path makes sense for you. My name is Kristen E. I'm the Academic Dean at Cambridge College of Healthcare and Technology. We run a Bachelor of Science in Healthcare Administration, a fully online degree completion program built for people who are already working in healthcare. Cambridge is an accredited college that has been training healthcare professionals for years. Nurses, sonographers, radiology techs, health IT professionals. There are thousands of graduates working in hospitals and clinics right now. Most students finish in about 75 weeks while they keep working. Here's what I hear more than anything when on my calls. Someone will tell me, I've been here 5 years. I know how this place runs better than most of the people above me. But every time a coordinator spot opens up or an office manager role or anything with a real responsibility, I don't get considered because I don't have a bachelor's degree. That's the number one reason people reach out. They're not trying to switch careers. They already know what they're good at. The credential is the only thing between them and these roles. And the longer you wait, the more times you watch someone else get the title you know you could handle. Someone who hasn't been there as long as you, but they had the degree, so they got the interview. Most administrative and leadership roles in healthcare, patient experience coordinators, HR specialist, office manager, department leads require a bachelor's degree just to be considered. That's the filter. If you don't have it, your application doesn't make it past the first screen. It doesn't matter how much experience you have. Here's how people in your situation are changing that. First, they book a short call. You can click the button, pick up the time that works for you, and you'll actually talk with someone who actually understands healthcare careers. They'll ask about your current role, your experience, and what you actually want next. And they'll tell you honestly whether finishing a bachelor's degree here is actually going to help you get where you want to go. If that's not a fit, they'll tell you the point to give you clarity. If it does make sense, the next piece is fitting school into your life. The program is a Bachelor of Science in Healthcare Administration. You can come with your associate degree in healthcare, business, or a related field, and Cambridge picks up from there. You're not starting over, you're finishing what you've already started. It's 100% online. You do coursework on your time, early mornings, late nights, weekends, whatever works around your job. The full program is about 75 weeks. You can cover healthcare operations, leadership, healthcare law and ethics, human resources, compliance. Everything department leads and administrators actually get evaluated on. How to manage a team, how to improve how a clinic or a hospital unit runs day to day. Is it work? Yes. But it's planned so that you can put on a calendar, not the kind of chaos you're probably dealing with now. While you're moving through the program, you're building towards a clear outcome on the other side. Instead of being told about policy changes at a morning huddle, you're one of the people in the meeting, deciding how the clinic runs. Instead of sprinting through back-to-back patients every shift, you're leading the team that makes that shift smoother for everyone. More say in how things operate, more control over your schedule, less time on your feet. Most students in this program look a lot like you. It's the medical assistant who's been carrying a clinic for years, but keeps getting told they need the degree before anything can change. The billing and coding specialist who's sharp on the numbers and can see exactly where the admin side of the operation is broken. Or the front desk or patient care staff member who practically runs the office already and is tired of watching people with less experience get promoted because they had the credential on paper. One of our recent students has been a medical assistant for 8 years. She's finished the program while working full-time and moved into an office coordinator role at the same health system. Now, this isn't for everybody. It's a strong fit If you've already have an associate's degree in healthcare, business, or a related field, you've been working in the industry, you're done with entry level, and you want to move into administration, management, or leadership. This is for you if you want to stay in healthcare. You're looking for a career upgrade, not a career change. If you genuinely love your current role and have zero interest in making time for school right now, this probably isn't the right moment for you. But if you've been feeling capped, stuck, or like you're watching others move up while you stay in place and you're still watching this, you're probably the person we built this for. So just to recap, this is a fully online program for a Bachelor of Science in Healthcare Administration you can complete in about 75 weeks while you keep working. You can come in with your associate degree already done. Cambridge picks up from there. You're not starting over. You're finishing what you've already started. There's an optional internship or a management-focused capstone if that fits your life better. You can come out with a bachelor degree from an accredited college that helps you get past the filter on a job posting instead of an auto-sorted out. Cambridge has financial aid options for students who qualify, and the career path calls is where you figure out your specific situation looks like and whether this makes sense for you right now or down the road. A bachelor degree is a real commitment. You'll be working, studying, and still doing life. There will be tired nights. So the real question isn't, is this easy? The question is, which future is harder to live with? Staying where you are, watching someone with different letters after their names step into the jobs that you know you can do, or using the next 75 weeks to build a credential that removes the filter that has been keeping you out. You've already put in the years into this field. You already know how to show up when things are hard. This is just pointing the same effort at a better outcome. If you're still here, the next step is simple. Click the button by this video. Pick a time for a 15-minute career path call. If you are making the decision with a partner, have them sit in on the call too. You'll walk through your current role, your experience, your goals, and see how this program would fit into your life, including financial aid options for those who qualify. If it's a fit, you'll leave that call with a clear plan and a timeline. And if that's not, at least you'll know that before you spend $1. You've already put in the years in healthcare. Take 15 minutes to find out if this is the move that finally lines up with what you're capable of. Click the button and book your call.